Hey everybody, Hirsch Shukla here with Orthopedic and Spine Physical Therapy. I just wanted to talk to you a little bit about one of the most common causes of lower back pain that we see in our office here, okay, and that is arthritis. And lumped in with arthritis comes spinal stenosis and degenerative disc disease. And I'm going to explain what these things are and how they can impact your ability to move, and of course how they can cause you pain. Okay, so what we're looking at here is a diagram of your spine. This is a diagram of your spine if you are facing in this direction, okay? So this is the front of your body, this is the back of your body. All right, you have your vertebrae, you have your disc, and you have your spinal cord, okay? And at every disc level, your spinal cord sends a nerve that goes out to your body somewhere, okay? It's a very general drawing of your spine. So degenerative disc disease occurs when this disc, which is supposed to be a certain height, okay, starts to get more narrow, all right? This surface of this vertebrae and this surface of this vertebrae start to sit closer together, and when that happens, you start to get things rubbing against each other, okay? This surface here and this surface here start to rub against each other, and that can cause significant inflammation, irritation, and ultimately pain. Okay, that would be degenerative disc disease, and that would be arthritis, okay? Spinal stenosis is when that occurs, okay? The disc gets more narrow. This hole, okay, where your nerve actually comes out, this hole gets smaller. And when that hole gets smaller, when you walk or when you stand and when you do certain things, you can get a lot of rubbing and you can get a lot of pressure on things that don't necessarily like to have pressure on them. Okay, so how do we get rid of that? Like, how do we deal with that? Well, I'm going to show you 3 exercises that you can do to help yourself if you're in this situation. Okay, by the way, most people that deal with arthritis, spinal stenosis, and degenerative disc disease are over the age of 55 years old. Okay, and typically they will tell me that they have a lot more difficulty standing and walking. Especially if they're with spinal stenosis, they can walk for about maybe 3 to 5 minutes before they're really looking for a chair where they can sit down. And as soon as they sit down, within 30 seconds, they start feeling better and they can get up and walk again. Okay? They feel much better when they are sitting, much better when they're lying down. Like when they get out of bed in the morning is a pretty good time for them because they've been lying down for several hours overnight. Okay, the reason that feels better to them is because when they lie down, their spine can spread apart. Okay, gravity is not crunching down on their spine. When they lay down, their spine spreads apart, and it allows a little bit of space to occur between these bones, and then overnight your inflammation will lessen a little bit. Okay, so we're going to show you a few exercises that you can do to help yourself when it comes to having arthritis and spinal stenosis and degenerative disc disease. Okay, the first exercise is going to be called knee to chest, knees to chest. All right, what you're going to do is you're going to lie down on your bed, okay, or on a floor, like a firm floor would be fine. All you want to do is you want to bring both knees up, give them a good solid hug for a few seconds, and then control them on the way down. You do it again, hold for a few seconds, and you come down. You do it again, hold for a few seconds, and come down. You want to repeat that 10 times. If that is too difficult or too painful for you, what you can do is just do one knee at a time. Hold it for a few seconds, release, go with the other knee. Hold it for a few seconds and release, and just repeat until you get 10 times on each side, holding just for a couple of seconds. Don't have to hold for a long time, and just squeeze as much as you feel appropriate for you. All right? The next exercise is going to be what we call lower trunk rotation. Okay, lower trunk rotation occurs when your feet and knees are together, okay, and you just roll your knees to the side. Notice my head, my shoulders are staying on the table, okay, you just roll to the one side, pause for a couple of seconds, roll to the other side, and come back up. Just roll as far as you can. You don't have to roll too far. If this is all the farther you can go, that's fine. And then you can go to the other side. If this is all the farther you can go, that's fine. Your goal, of course, is to roll farther, but not at the cost of having more pain. All right, you just go back and forth until you get 10 times to each side. All right, the last exercise I'm gonna teach you is to stretch out the back of your legs. All right, what that looks like is you're gonna straighten out your one leg, Okay, the other leg, I want you to interlock your fingers behind your knee. And all you're gonna do is you're gonna straighten that leg toward the ceiling. Just go as far as you can. As you notice, I have some tight hamstrings, but I just want you to straighten out as far as you can. Hold for a couple seconds and bring it down. And take it up, hold for a couple of seconds and bring it down. And take it up and hold for a couple of seconds and bring it down. You do that 10 times on one side and then switch 10 times on the other side. All right. And this is just going to help stretch out your hamstring muscles, but it's also going to actually create a little bit more space between those vertebrae at the lower part of your spine. And that's really what this is all about. Okay, gaining that room, gaining that space, but also just getting it to move. Okay, try those 3 exercises, and hope it works out for you. And stay tuned for more information on the other common causes of lower back pain.